So this is an update on the subgroup analysis from LOTIS-2. LOTIS-2 was a phase 2 study that included patients with relapsed and refractory diffuse large B-cell lymphoma after at least 2 lines of therapy. It was a trial that included multiple different subtypes of or subgroups of diffuse large B, including some of those with high risk. And in this trial, in this abstract, we updated the outcomes by subgroup, and including patients with advanced age, as those were older than 75 years of age, those with high-grade B-cell lymphoma, those with double and triple hit lymphoma, and those with a history of previous transplant or previous transformed lymphoma. The main important component of the study was that this is a antibody-drug immunoconjugate that was given every 3 weeks, given for until the response continued. And then in terms of the responses, most of what we observed was that the subgroups of different high risks disease had similar response and similar duration of response compared to the general group. So high-risk groups had comparable outcomes without clear increase in toxicity for those who were older or who had more advanced disease. We did observe that the total population had an observed response rate of 48%, with a complete response rate of 23.4% partial response. The median duration response for the 70 responders was 13.4 months, but it had not been reached for patients with complete remission. Those with double or triple hit had a median duration of response that had not been reached, as was for patients with advanced stage disease, the median duration of response of 12.6 months. And for patients that had older age, over 75, had not, those who were responding had not reached a median duration of response, and those who were younger than 65 had a median duration of response of 12.6 months. So in general, patients who were higher risk had comparable outcomes to the general trial group.